A new glucose monitoring system for diabetics may mean that painful and invasive skin pricks to draw blood samples will soon be a thing of the past. Scientists at the University of Maryland have created a testing procedure that uses contact lenses to provide a reading of the wearer's blood sugar level. Here to tell us more is Dr. Chris Geddes, Associate Director of the Center for Fluorescence Spectroscopy at the University of Maryland, and he joins me from Baltimore. So, Dr. Geddes, how do these contact lenses work?
Well, here with my colleagues Joseph Lakovitz and Ramchandran Bagdu here at the University of Maryland Biotechnology Institute, we've developed a range of glucose sensing contact lenses that contain very novel and clever little fluorescent molecules that change their fluorescence response in the presence of glucose.
So take me through this then. How would this work to test the amount of glucose in somebody's blood?
Well, normally, if one wants to measure, a diabetic wants to measure their glucose in their blood, they typically finger prick about 4 or 5 times daily. This process is invasive, it's non-continuous, and so during these non-continuous moments, these can be very adverse to health conditions. So our technology can be worn by a diabetic, and the contact lens changes color in response to changes in glucose in tear levels. Now, the concentration of glucose in tear level is very, very low. It's about 150 to 500 micromolar, and this typically changes for the onset of diabetes.
Okay, and sorry, just before we go ahead, micromolar, can you give us a sense of how much that really is?
It's very, very small amounts. It's about a 10-fold lower concentration than the glucose in blood.
But you can still detect it?
We can detect it because we've developed some very, 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 very new molecules that can sense ultra-low concentrations of glucose.
So these fluorescent molecules are sitting in the lens, and do they actually come in contact with the glucose in the tears?
That's right. This glucose in the tears, it tracks the blood levels by with about a 30-minute lag time, and the glucose diffuses into the tears, and the glucose, these molecules that are sensitive to glucose, change color and change their fluorescence response inside the contact lens.
And is the color change obvious?
We've developed actually 2 types of contact lenses. One of them is a colorimetric-based response where the lens actually physically changes color. The idea being here that the patient can actually just look in a mirror and then see the change in the color of the contact lens, and against a pre-calibrated strip could actually determine the level of glucose that they have in their tears and therefore in blood. And in the second range of contact lenses we've developed, we can actually use a handheld device that flashes in the eye and actually determines the level of glucose in tears and therefore the concentration in blood.
Now, could this technology, Dr. Geddes, be as accurate as the current pinprick blood test?
That's a really interesting question. It's probably likely that it is, but we won't know that until we go to clinical trials, which is probably about maybe 3 to 5 years away, depending on finding a suitable commercial partner.
Now, this may be a silly question, but if I'm wearing the type of lens that actually visibly changes colors such that I can see it in the mirror, and I'm looking through that lens, is the entire world changing color for me?
I guess it would be, but we thought about that a little while ago, and we developed contact lenses that have little sensor spots on the surface, and these sensor spots can potentially change color to the glucose, and you could either have them inside your visual acuity or outside your visual acuity. And the power of having a visually changing contact lens that is actually changing color is that parents of young diabetics or care workers of the elderly could potentially see somebody else's glucose response.
Now, I know that, you're still developing this technology, but have you thought about detecting other body chemicals in tears using this sort of system?
That's actually a very good question. We started the glucose project here in the Center for Fluorescence Spectroscopy about 3 years ago, and since that time we've actually been looking at sensing things like lithium, sodium, potassium, potentially histamine and even cholesterol inside a contact lens for potentially point-of-care clinical assessment. For example, some patients may need to monitor their lithium levels that they actually have for stability. And basically what we have is a contact lens that on the surface of this contact lens has many different sensor spots, and each of these sensor spots can change color depending on a specific clinical analyte that you might need to measure. In addition to clinical assessment, we've also been developing a range of contact lenses potentially for the universal soldier, a military application, whereby a contact lens has sensor spots on the surface, and these sensor spots can be sensitive to things like cyanide or different types of bioagents. So potentially a soldier can be on the battlefield and he can have red light, blue light type of indicators on the surface of a contact lens, indicating if he's exposed to any type of bioagents.
Well, it's fascinating. Thanks, Dr. Geddes.
Thank you very much.
Dr. Chris Geddes is the Associate Director for the Center for Fluorescence Spectroscopy at the University of Maryland. He joined me from Baltimore.